Let's discuss the FMGE CBT psychiatry questions. I am Dr. Sachin, psychiatry faculty. There are 5 questions in this particular paper. Let's discuss them one by one. Let's read the question carefully. All of the following are not true about suicide except. So not and true is cancelled. We have to tell which is true. Not true except. That means true. People who talk about suicide rarely commit suicide. No, false. People who talk about suicide, they do commit suicide. They do give prior warnings. It's a myth that people who actually commit suicide will not give prior warning and they'll directly die. No, they do give. All suicidal threats are not to be taken seriously. Again, false. Why? Because they are to be taken seriously. That people who do commit suicide do give prior warnings. Okay. Asking about suicidal attempt in a psychiatric interview increases the risk of suicide. No, it decreases the risk of suicide because it will relieve the anxiety surrounding the feeling, and the patient will feel that someone is taking care, someone is asking why I committed suicide. Among all the risk factors, hopelessness is the most common risk factor. No, previous suicidal attempt is the most important risk factor. Previous suicidal attempt, because hopelessness is a factor but previous attempt is most important. Just have a look about myths about suicide. Suicidal people keep their plan to themselves. No, it's a myth. Fact is, they communicate their intent sometime during the week preceding the attempt. Second myth, those who talk about suicide don't do it. No, people who talk about suicide may try. Okay? Talking to someone about their suicidal feeling will cause them to commit suicide. No, it's a myth. Usually makes the person relieved. And among the risk factor for suicide, the most important risk factor is previous suicidal attempt. Yes, family history, male gender, hopelessness, they all are risk factors, but the most important is previous suicidal attempt. In MMSC, mini mental status examination, highest score is given to orientation is 10 marks, language is 9 marks, attention and calculation 5 marks, registration 3 marks, and recall 3 marks. So the total highest score is given to orientation. There are 5 domains in MMSC. Have a look here. Orientation. We ask the patient what is the year, season, date, day, month. Orientation to time and place. 5 marks for time, 5 for place. Total 10. Registration, we tell them register 3 objects. Recall, we tell them to recall 3 objects. Attention and calculation 5, CL 100 minus 7. And language comes total of 9. So orientation is a better answer to highest score given. You just need to remember the broad names. 5 domains are tested in MMSC, mini mental status examination. It's a screening test for dementia. Fell down after hearing a loud sound at the party. Loss of tone on emotional events, whether it is a fear or happiness, somebody cracking a joke, or sadness, any emotional event is given a term called cataplexy. Catalepsy is increased tone, which is seen in catatonia. Cataplexy is seen in narcolepsy. Remember this: cataplexy, decreased tone, seen in narcolepsy. Catalepsy, increased tone, seen in catatonia. Remember this. Which of the following is not a REM sleep disorder? Narcolepsy is a REM sleep disorder. Nightmare is a REM sleep disorder. But night terror is an NREM disorder. These dreadful dreams are those dreams which are remembered. These dreadful dreams are those dreams which are not remembered. A person does not remember night terror but remembers nightmare. Okay, this is also seen in REM sleep apnea. A 60-year-old woman complained of depression was started on escitalopram. Escitalopram is SSRI, selective serotonin reuptake inhibitor, and given in elderly can cause lethargy, muscle weakness, and nausea. These are the symptoms of hyponatremia. And SSRI is known to cause hyponatremia in elderly. Very famous to cause hyponatremia in elderly. Okay, so these are this particular CBT psychiatry question. Wish you best of luck for your exam. Hope this video helps you. Thank you. Bye bye.